We have the last speaker for this session is Dr. Tara Biddle. Dr. Biddle is the Associate Division Chief of General Pediatrics and Community Health at Children's National, and she will be reviewing with us the COVID-19 vaccine distribution, keeping our focus on equity. Welcome, thank you.
Good afternoon, everyone. I'm so pleased to be here with you and have thoroughly enjoyed our other two presenters. I've had the pleasure of working with our vaccine distribution efforts here at Children's National once we had access to these wonderful vaccines. So for this portion of the presentation, we're really going to be looking at distribution of COVID-19 vaccine and grounding that in concepts of equity and racial equity. First, I want to acknowledge all of the wonderful work that took place early on as we neared the point that we would be ready to start giving vaccine. We saw that work at the level of the Centers for Disease Control, as well as states and more local jurisdictions, trying to prioritize who was going to receive the very first doses of vaccine, looking at who we knew to be high risk and determining who would be first in line to receive vaccine. I'm going to be looking more now that we are in a situation in which our supply and demand are better matched, and in some cases, supply exceeds demand. And so we're really looking at distribution to all members of our communities. So today we're going to briefly review the concepts of equity and equality. We'll utilize data to assess the current status of COVID-19 vaccination distribution nationally and locally, evaluate contributors to disparities in vaccination rates, and consider briefly global vaccine distribution equity. So first, just to level set, I'm sure that these are concepts that are familiar to many of you, but we want to draw a distinction between equality and equity. Equality means everybody gets exactly the same thing, and that seems fair on the surface. But if we look at this example, and this is actually my favorite depiction of this distinction, it comes from the Robert Wood Johnson Foundation. If we look at this example, everybody got the same bike, but clearly it's not working for everybody. In the other example with equity, in equity, everybody gets exactly what they need based on their own unique situation. And I just really like the way that this is shared and depicted here. So let's take a look at where we are in terms of distribution of vaccine. We'll start with national data. This comes from the Centers for Disease Control and is probably familiar to many of you. At this point, if we look at our total population across the country, 40% are fully vaccinated and 50% have received at least one dose of vaccine. If we narrow our lens to the population that's currently eligible to receive vaccine, 12 and older, close to half are fully vaccinated and close to 60% have received at least one dose. And finally, looking at our senior population, those who are 65 years of age and older, 3/4 now are fully vaccinated and more than 85% have received at least one dose. But we know when we look at statistics like this that we need to dig deeper. And so one of the ways we do that is looking at vaccination rates within different population demographic groups. This is also CDC data shared on their website. I've pulled out two graphs. On the left, we're looking at vaccination rates among members of different racial and ethnic groups. And on the right, we're looking at vaccination rates among individuals in different age groups. And to orient you to the way that this graph is set up, the gray bars represent the percentage of individuals from that demographic group in the US population at large. The darker blue bar looks at among persons who are fully vaccinated, what percentage fall into that demographic group. So if we look, for example, at these longest bars here, that represents individuals who are white and non-Hispanic. The gray bar shows us that just over 60% of the US population fall into the white non-Hispanic demographic group, and a slightly larger percentage among all persons who are fully vaccinated. Now, we'd like to see in a world in which we are vaccinating equally through racial and ethnic groups that those bars align, but we know that that's not the case because there continue to be significant disparities in vaccination rates. Interestingly, though, if you look at the light blue bar, That represents among persons who completed all recommended doses within the last 14 days, the percent that fall into that racial or ethnic group. So where we have a higher percentage of individuals who self-identified as white, non-Hispanic, and received vaccine early, it's a much lower percentage of the folks who completed the vaccine series within the past 2 weeks. If we turn our attention up to the top group here, this is the group identified as Hispanic or Latinx. We see that while vaccination rates among this group are trailing relative to the percentage in the general population, within the last 14 days, we've seen a significant progress in terms of vaccination among that group. Now we'll narrow our attention to the District of Columbia specifically, where currently about 40% of DC residents are fully vaccinated and just over half are either partially or fully vaccinated. Now, like many other health outcomes and health indicators in our city, if we narrow our attention to individual what's called health planning neighborhoods around the city, there continue to be very significant disparities. The neighborhoods that have the darkest shading represent the neighborhoods in which the vaccination rates are the highest, with a peak of about 55%. The neighborhoods with lighter shading represent the areas that have the lowest rates. And if you're familiar with the city, you'll see that those areas are largely wards 7 and 8 here in the district. If you are familiar with other mappings of other health indicators and outcomes, this aligns well with other areas in which there are significant health disparities in our city. As we began providing vaccine to residents of the district at Children's National, equity was really a founding principle in our strategy and really drove the way that we approached our distribution from the very beginning. We leveraged heavily data from the DC Department of Health about what communities here in the district were most heavily impacted by COVID-19 illness. Looking specifically at wards 7 and 8 that I already highlighted for you in terms of vaccination rates, as well as a group of other priority zip codes for the district identified by DC Health. Again, sites with higher rates of COVID-19 illness and mortality and lower early rates of vaccination. So we've been tracking that throughout our vaccine distribution efforts. Because we opted to partner with DC Health, our Department of Health here in the city, to provide vaccine not just to patients of Children's National, but also to other children, adolescents, and young adults in the city, we've used as our benchmarks population indicators for DC residents. So for example, if you look at the patients who have received vaccine from us, 18.5% live in ward 7 or 8. We're benchmarking that against the percentage of the general population who live in wards 7 and 8, which is at about 22%. And importantly, if we look more specifically at the age group that's our target population in terms of being a pediatric facility, using some data from DC Health Matters, the percentage specifically of 10 to 24-year-olds who live in wards 7 and 8 is about 25%. So you can see we still have work to do in terms of vaccination rates in those communities. If we look at the vaccines provided by that race and ethnicity lens, about 40% of patients who've received vaccines from us identified their race as Black or African American. And that's in comparison to the general city population of about 44%, so pretty comparable. If we look at ethnicity, 14% of our patients identified their ethnicity as Hispanic, and that's compared to a city rate of about 12%. We've been fortunate to also partner with the Department of Health in Prince George's County, Maryland, which they provided vaccine for us to distribute to residents in their county. And we've been able to do so at our regional outpatient center in Prince George's County. So we've been doing similar tracking related to race, ethnicity, and other demographic characteristics in that community as well. Now, to give you a sense in terms of our strategy to try to make sure that we were distributing vaccine as equitably as possible, one of the key factors was where we provided vaccine. And this gives you a sense of the sites where we've been distributing vaccine. We actually launched our efforts at our primary care facility at the ARC in Ward 8 in DC. As we've continued, vaccine at United Medical Center, which is also in Ward 8. at the Children's National Hospital facility on Michigan Avenue in Ward 5. And more recently, we hosted a large event at our new Children's National Research and Innovation campus in Ward 4 in DC. And as I mentioned, we've continued to distribute vaccine at our Prince George's County Regional Outpatient Center. The other thing that was really important, not only where we provided vaccine, but also particularly early on when demand exceeded supply, we were always really careful to reach out to our target communities first, meaning as soon as we had vaccine that we were able to offer, we would do our outreach, such as text messages and other directed outreach to residents of our high priority communities, and then worked back to make sure that we eventually reached out to all of our targeted patient populations. Now we're going to turn our attention to a brief discussion of contributors to disparities in vaccination rates. Over the past several months, as we've all looked at spread of the vaccine, uptake of the vaccine, there's been a lot of discussion about vaccine hesitancy. I'll share that two of my colleagues here at Children's National, Drs. Clarissa Dudley and Kathy Ferrer, have really reframed this as vaccine thoughtfulness, which appeals to me because I think it really reflects the depth of processing, thought, consideration that go into individual decision-making about moving forward with vaccine. I also want to put forth that no conversation about COVID vaccine and disparities in equity can take place without really acknowledging the profound impact of history on decision-making about vaccination, the history of experimentation, Black Americans, abuse of Black Americans and other people of color by the healthcare system, as well as the ongoing impact of systemic racism on people, wellness, health outcomes, et cetera, are all incredibly important, need to be acknowledged and considered when we're talking with individuals about vaccine. We need to continue to provide information about vaccine in as transparent and unbiased a manner as we can, and really leverage trusted voices to share information about vaccine in all of those important one-on-one encounters. I mention that though, because I think we tend to point to vaccine hesitancy as the primary rationale for disparities in vaccination. And I would bring to you that there are so many other reasons that we see these disparities, and it's our job to question constantly what barriers are there and what can we do as organizations, as jurisdictions, as governments, as providers, as individuals to address those barriers and continue to work toward vaccination for as many individuals as possible. You're seeing a lot of coverage about that in the lay media. Here we have some examples from the Washington Post, from NBC News and Journal. Here's something from Scientific American. I have spent a good bit of time reviewing information from the Kaiser Family Foundation. They, over time, have done this COVID-19 vaccine monitor report in which they do periodic surveys as well as use of qualitative methods to elicit information on a number of topics related to COVID-19 vaccine uptake, interest, distribution, et cetera. I pulled a couple of these for you just because there were points that jumped out to me that I wanted to bring to you. The two that I'll share were from survey data gathered between April 15th and 29th, 2021, to give you a sense of where we were in the course of the pandemic and in vaccine distribution at the time that the survey data was collected. So first, this looks at a group of individuals who have not yet been vaccinated against COVID-19. And they asked them, when an FDA authorized vaccine for COVID-19 is available to you for free, do you think you'll get vaccinated? It really struck me that 1 out of 3 Hispanic adults wanted to get that vaccine as soon as possible, and that was in late April. For those of us here in the DC region, we have definitely been in a situation in which supply exceeded demand, and particularly in the district where I live and practice, the district has been very intentional in opening walk-in centers that are located throughout the city. Clearly, this is a national survey, and that reality is not the same for everyone in every community around the country. But there still is a very significant number of individuals who would like to get the vaccine as soon as possible, including 1 out of 6 Black and white adults who were surveyed. The second graph that I wanted to share with you looks at its specific concerns about COVID-19 vaccines and then sorts by intention around vaccination. And it reflects the percentage of folks who say they are very or somewhat concerned about each of the following when thinking about the COVID-19 vaccine. The dark blue represents the total, and then you'll see that same, sort of, I want to get it as soon as possible. I'm in that wait and see mode, only if I'm required to get it, and then definitely not. Some of these things I think will look very familiar to you when you think about your own conversations with folks about getting vaccinated and what you've perhaps seen covered in the media, et cetera. The ones that I wanted to specifically point out to you, though, when you're thinking about equity, when you're thinking about systems of distribution, one, close to half of individuals surveyed across all groups reported concerns about needing to miss work if the side effects of the vaccine made them feel sick for a day or more. And if you think about individuals who don't get paid when they miss work or may lose their job if they miss work, that is a real disincentive and something that we can do much better on related to distribution. Second, concern about needing to pay out of pocket to get the vaccine. And finally, being concerned they won't be able to get the vaccine from a place that they trust. So again, we're hearing a lot about moving away now from mass vaccination events, getting it into primary care, getting it into places that are places of trust, like faith and worship centers, and other schools, employers, et cetera. So I think that's a really important part of the strategy that we're going to need to work on. And I'll share that this week, we actually celebrated our first doses in primary care at Children's National, distributed out of our mobile van program, which was really exciting. And finally, just a few thoughts about global vaccine equity. The CDC also shares information about vaccination rates around the world. This is not news to any of you, but this looks specifically at cumulative doses administered per 100 people in the country. The dark blue circles represent the highest number of doses administered per 100, and the light circles the lowest. And this one really spoke to me about the huge variability in vaccination rates among countries around the world. Just this week, there was an opinion piece in the Washington Post written by leaders of the International Monetary Fund, the World Health Organization, the World Bank Group, and the World Trade Organization, really calling for a new commitment to equity in vaccine distribution and strategies in terms of moving forward and defeating the COVID pandemic. So finally, to reiterate key themes from my perspective in terms of equitable vaccine distribution, I would encourage you to really question vaccine hesitancy as the cause of disparities in vaccination rates and make sure that we're identifying and leveraging opportunities to address other system barriers as we work toward vaccination. Prioritize data collection to track progress. We don't know if we're succeeding unless we're measuring, and I know that all of you know that. Ground your strategy in the concepts of health equity and reassess regularly to make sure that you're on track and course correct as needed. And then finally, think local, think regional, national, and global. Thanks very much.